If I can help even one more person learn more about their own symptoms or become more empathetic, then I've achieved my goal with these videos. I also realize that everyone has his or her own life's journeys and struggles, and many of them are far, far more difficult than mine. Alright, it has been about 5 months since my last video. Since then, I have a new bandana that I can wear on my head, as well as ice packs. It also has inserts on it, which are kind of cool. A lot of migraine patients use them. I've also tried a wide variety of different medications and combinations of medications from my doctor to try to relieve the daily and severe headaches I have. I've learned about several more things, and I wanted to share some updates on where I'm at and how things are going. The most recent addition to my medications, as well as being able to finally go to physiotherapy consistently, I'm making some pretty significant changes, and my headaches are decreasing quite significantly. I'm actually able to not wear an ice pack all the time, and hopefully I will only be able to be using them rarely. First of all, sleep hygiene. For those suffering from MTBIs, mild traumatic brain injuries, or even traumatic brain injuries, or for anyone at all, look up the ideas online. Try to follow them as closely as you can, and you'll get far better night's sleep, and you will be able to face the challenges you face each day far better. Related to this is consider getting a better pillow, one that fits better with however you sleep, and that might help also with some neck related issues if you have them. Second, although there is no set protocol for medications, or which ones to try or in which order to use them for brain related headaches, a Dr. Keith Sekira, who is on Parkwood staff and who deals with migraine patients all the time, did a video series recently, and on his video series he explained which medications he uses and in what order he typically uses them, although obviously they vary from patient to patient. Okay, the first medications he typically tries are called amitriptyline or nortriptyline. Okay, after that he typically does gabapentin. If those aren't working or the side effects are too severe, then he considers Lyrica, or Topamax, Effexor, or Cymbalta. And I've also known of several doctors who have tried Tegretol. Again, look up his video online. You're encouraged to learn more about them. Realize the more medications you take or somebody takes, the more likely they are to have side effects. And again, your doctor trust your doctor. They are amazing people, and they often don't always know what to do with these different type of headaches. All right. Never stop asking for relief, and never stop trying different things to see what might work. Your doctor may also be thankful to find out what other doctors, specifically doctors who are dealing with brain injury related headache patients a lot, what medications they are trying. It might help them, your own doctor, better treat patients, both you and others. Okay, one other thing Dr. Sekira pointed out that's really important to think about is that brain related headaches after the first few weeks are not related to pain problems in your brain that are the sensors are effectively working with. In effect, what has happened is the pain sensors in your brain have kind of gone AWOL or offline, or some of them have at least, and they're causing these headaches, and they're not related to any particular problem in your brain. And so the goal is to find the lowest amount of medications and the right ones, which will kind of stop these sensors from going off. Stay on those medications for 3 or 6 months, and then slowly wean off those medications. And usually what happens, just about always, is those pain sensors have stopped going off anymore, and everything headache-wise is back to normal. It doesn't solve the memory issues, it doesn't solve the eye issues or some of the ear issues, it doesn't solve some of the other issues that continue to happen, but at least the headaches which are a big part of the challenges, are much reduced. And again, remember that with brain injuries, in a way similar to strokes, but obviously that's in a far different area, and they're often far more severe, is that no one knows how long they take to heal, how much someone might heal, and how quickly someone might heal. Okay, supplements. The neurologist I see mentioned several supplements to consider. When thinking about supplements for brain-related headaches, you need to remember that A, they usually take 3 months to start working, and B, so they, especially Q10, can get fairly expensive, and C, they often won't lead to a high level of change or improvement. They will help with some improvement, but not a tremendous amount. Okay, so the 3 supplements that the neurologists I see suggested were magnesium, vitamin B2, and Q10. Going back to Parkwood, it might be useful to know that Parkwood has a referral form for their MTBI outpatient program for people who have been struggling with these brain-related issues for a year or longer, and they have this program, one-on-one sessions, and a bunch more of activities and places to go online where they can help you better plan and pace your life, and better deal with the different challenges you have and create different scaffolds for them. If you go to a concussion management clinic, they have the form, and when and if it's needed, they will fill out the form and refer you to your family doctor to have them consider whether you should be referred. If your family doctor hasn't heard of the form, here is what it looks like. Okay, something I do and I highly suggest other people do is consider short and long-term goals. Keeping them in front of you all the time, keep what you're working on. It may be to crochet a washcloth, or 2, or 3, or 4, or a scarf, or maybe many more. It might be to learn how to rug hook. It might be to even finish a word search, and it might take you 10 minutes or half an hour or longer. It took me quite a while before. It might be to do an easy Sudoku puzzle or a harder one. Okay, keep those in mind. Those are all some of the different things you might try. It might take you a whole day to do the dishes and work through them. Okay, it might be to try a new recipe. Tell trusted people your goals, whatever they are. Keep encouraging, so that they keep encouraging you. It's really easy to get depressed or give up or get frustrated by people who don't understand, including doctors, or by people who are constantly challenging you with your symptoms or doubting you. You may have to choose or change some of your hobbies. You may have to go back to work part-time or change your job or some other thing. Always remember that with God, anything is possible. I use whiteboards to track some of my activities. Here's one for menus to help me plan what to cook and when. I use another one, as you can see here, to kind of help keep my family organized and write down some of my goals so I don't forget, and so my family helps with them. I also have an agenda that I use. This is January, so obviously the pages aren't filled in. I even cook several parts, so if I'm doing shepherd's pie, I cook the hamburger and the potatoes earlier in the day, so during the busy time, and the vegetables earlier in the day, so in the busy time, I can just put them in the oven and have them warm up, and I don't have to worry about cooking them and doing a whole bunch of things at once. This book I found, called Lost and Found, it is full of a whole bunch of strategies. Again, only read 2 or 3 pages and try them at once. Don't go through the whole book at once. It's full of all kinds of ideas. Something else that I'm improving on, especially as my headaches are decreasing and I'm doing a lot more of, is exercising. It gets you fresh air, keeps you connected to people. It increases your blood flow, your regulation of your brain, your heart rate, keeps your muscles from getting all mushy and gooey. And it might even help you lose weight, or at least not gain weight. If walking outside is too loud or hard, and treadmills is too noisy or too expensive to get, consider an exercise bike. They now are super quiet. You can wear ice packs on your head. So for me, as my headache's warming up now, I might put an ice pack on in a few minutes. You can wear them while biking. You can just use your legs for it. It increases your heart rate, but you don't have to worry about your balance. You don't have to worry about your head moving in space. So it's really good for those things. The temptation to avoid people and situations and the busyness and constant busyness in stores is really high. It's really tempting, especially for me with the music in stores. I just avoid them, and that's not always helpful. Resist that continual temptation as much as possible. Find trusted friends to go with, to come over to visit. Find alternative quiet places. Maybe you get a coffee and you go, if you're in Sarnia, you go to the bridge and you just sit in the car or your friend's car and you look outside and it's quiet. Okay? For me, I think I finally found the combination of medications that are starting to help quite a bit with my headaches. Although one of them is Botox, which wears off every 3 months, so I'll have to wait and see. I still can't handle the TV or lots of sounds or noise or things going on around me, but I'm getting a lot better. I have to be aware that my eyes and ears may heal a lot more and my short-term memory may heal a lot more, or it may not, and so I need to put in different things and different agendas and boards and things to work with it. Either way, I plan my short and long-term goals based on what I can currently do. I focus on only using what are called A batteries and not digging into my B and C batteries, which take a lot longer to recover from. Plan and pace carefully. It's quite possible that a very hard part yet is to come, as people expect me to be exactly who I was, and I'm not currently that person. However, no one is unchanged after going through a difficult journey. Thank you everyone for your constant prayers, encouragement, and support throughout this journey. I continue to not know where things will lead, but who does? I just have to focus on living in the moment and always doing the best I can. I know it is hard to know what to say to someone who has gone through a journey like this, just as it is hard for me to know what to say back. However, I hope to see you soon. Take care for now.